Hello viewers, today we will discuss about a case of an old man who presented to us with history of fever, cough with sputum that was yellow in color and weight loss. On general physical examination, he was emaciated, his look was pale and his blood pressure was 70/50. There was no history of hypertension, diabetes and ischemic heart disease, but there was a history of pulmonary tuberculosis in the family. By considering his history and clinical examination, the first investigation which I advised, that was X-ray chest PAV. When I look at the X-ray chest, there was bilateral infiltrate more on the right side, and he was labeled as a case of pulmonary tuberculosis. The further investigations which were advised to the patient was sputum for AFP and gene expert, random blood sugar and serum electrolyte. The provisional diagnosis in this patient was pulmonary tuberculosis, and the plan was to start the anti-tubercular drug for 6 months. Because this patient has low blood pressure along with extensive pulmonary lung disease, and I have a plan to start the ATT, I always be vigilant in this patient. And what can be the possibility of decreased blood pressure in this patient? That can be the poor nutrition, low intake of fluid and food, and also there can be the involvement of the adrenal gland, that is the common site for the pulmonary or extrapulmonary tuberculosis. Because this patient has extensive pulmonary lung disease, there is the possibility of involvement of the other organs, and the adrenal can be the possibility. Because in this patient, BP was low. But at this moment, if I jump to start the anti-tubercular drug, there can be the risk of the deterioration of the patient condition, and the most common complication in this patient can be the drop of the blood pressure. And what is the reason of the drop of the blood pressure in this patient? That is can be due to anti-tubercular drug, because rifampicin is an enzyme inducer, and that can enhance the metabolism of the corticosteroids, and there can be the possibility of development of the hypovolemic shock in this patient. And there can be the further deterioration if there is involvement of the adrenal gland. So in this type of the patient, whenever we decide to start the anti-tubercular drug, we must give the steroid. What can be the benefit of the steroid in such type of the patients? First is this, that they will work as the anti-inflammatory and reduce the inflammatory process due to tuberculosis in the lung or anywhere in the body. And the second thing is, if there is induction of enzymes and drop of the corticosteroid level in the body, then exogenous intake of the steroid will replete the steroids, and there can be the less risk of the further drop of the blood pressure in this patient. But remember this, that never start steroid in any tuberculosis patient without the cover of the anti-TB drug. What can happen if we start the steroid alone? There can be the speed up of the disease progress, and there can be the deterioration of the patient condition and spread of the mycobacteria in the body. So be vigilant when we are going to start steroid to a patient who is a case of tuberculosis. Then always give under the cover of anti-TB drug. And steroid can also be started in many type of the extrapulmonary tuberculosis as well. That can be the tuberculosis meningitis, that can be the adrenal tuberculosis, that can be the pericarditis, pleural effusion, intestinal tuberculosis, caries spine. All are the indication to start the steroid, but under the cover of the anti-TB drug. Always remain vigilant. If there is a drop of the blood pressure, if we have started the TB drug, then we must start the steroid to enhance the patient condition, to build up the patient blood pressure, and to speed up the recovery of the patient from his or her illness. Thanks for watching, and don't leave without LSCS.